That one, yeah. Good. Warm welcome to everyone joining us today for our analyst briefing on the subject of the Health Tech 250, also known as the most promising early stage digital health ventures in 2022, with a focus today on Europe. We are going to dwell a few minutes just to allow everyone who has registered to join us. In the meantime, those of you already here, suggest you grab yourself a coffee, glass of water, and we'll see you back here in a couple of minutes. Thank you very much. And for those of you who have joined, feel free to obviously start thinking of what questions you may have. We do prefer you to use a Q&A button at the bottom of your screens. That way we know what's the question versus just friendly chat. And also means that we can keep an eye on those we can answer live there and then during the presentation versus at the end. So feel free to ask your questions. We prefer questions as it helps us steer the conversation in a way that suits what you guys want to hear, as opposed to what we have defined as our script for today. So for those joining us, and of course to remain faithful to the time contract we have with you as you registered, we will start. So my name is Julien de Salaberry. I'm the CEO and the founder of Galen Growth. I'm talking to you today from Switzerland, which is where we have our European offices. And some of you may know our people in Asia Pac based in Singapore, or in fact, our team in the US based in Chicago. Galen Growth is the world's most trusted digital health data intel insights firm. We have as a core solution Health Tech Alpha, which is the world leader in digital health data intel insights, as a SaaS platform, which pharmacos, investors, consulting firms, pure tech firms, banks, etc., use to navigate the digital ecosystem across the globe in a factual and accurate manner. True to our cause, which is that we like to look at digital health through the lens of data rather than subjective rhetoric. And so we leverage that data to do some of the thematic reports that we have published. And for those of you familiar with us, you'll know those are available on our research page, galengrowth.com/research, or through our platform, Health Tech Alpha, for those who have an account. So those reports, including, for example, the one that we published most recently, which is, of course, the 5 regional ecosystem reports for Asia Pac, Middle East, Israel, North America, South America, and Europe, unmatched by any other data provider or even market research out there. But what we also like to do is to take a closer look at some of the ventures out there and look at how data would help us to find the most promising early stage digital health ventures based on the actual achievements and performance of that venture. Now, most of us are very familiar with the more growth stage and late stage ventures, simply because they tend to feature more regularly in the media. But fewer of us are familiar with the new ones, the new blood coming through. The annual analysis that we conduct is called the Health Tech 250. And it's 250 because we're trying to ensure that each region is fairly represented within the analysis, so as to recognize the most promising early stage digital ventures in each one of those 5 regions. Today, our focus is Europe. And as I was saying a little bit earlier on, our purpose for this analysis, which we conduct annually, is to bring attention to what we believe to be the digital health innovators of the future, of the tomorrow, those who have started strongly. And as you know, those of you familiar with the platform or our reports, we base that on data, so the 300 million also data points that we have in our platform. And we do look at the 14,000 digital health ventures on our platform in order to arrive at the shortlist of 250. With me, as usual, is our trusted head of research and analytics for Europe and North America. Today was her Europe hat on. Sara, Dr. Schmachtenberg, Sara Schmachtenberg. Most of you will probably be familiar with her, as she joins me for most of our analyst briefings. So Sara, let's start with a simple question, which is very quickly, what is the scope in terms, before we think about how we selected, what was the scope? What did we include or exclude? When we look at 14,000 ventures, we didn't look at all 14,000. So how do we shrink that down to a pool we can start looking at?
Thanks for the question. It's good to be here. Hello to everyone who's listening in. It was pretty simple. We wanted European ventures. So any of the ventures that we have within our region of Europe, and that includes the Western European countries, and they had to be have raised no more than their Series A at the time of our evaluation. So anything grant, seed, pre-A, Series A funding raise, and that's where we stopped. Like you said, we didn't want to get up to those very well-known names everybody knows. Not so much interesting to see them at the top of a list.
So was that all digital ventures with an office physically in Europe, or a bit more precise than that?
That is a good point. Those are ventures that were founded in Europe.
Okay, Europe. Okay, cool. And to be precise, we're looking at Western Europe, yeah? So Eastern Europe is not included in this analysis at this stage.
Right.
Okay, cool. Right. So that's a great start, and allows us to already have that step where to draw that box. Yeah. So it's the countries we would expect, you know, Benelux, Scandis, France, Germany, UK, Ireland, Spain, Italy, etc. Okay, great. So that's a great start. So let's shift slightly then and help our audience get an understanding of the methodology we used. Now, it is important to stress here that everything that we leverage is data sitting in Health Tech Alpha. And so, you know, we'll bring that to life in a little while. Therefore, we did not base our analysis on someone's Twitter feed or how many followers they've got, etc. We really focused on what the achievements of that venture were at the time of the analysis, November 2022, or actually December 2022 by the time we published, and of course, the leadership team of that venture in achieving those outcomes, yeah? Correct. So with that in mind, can you just walk us through what were the selection criteria that enable us to get from that fairly broad list of ventures, of course, because we're looking at Western Europe and we're looking at Series A and Pre-A. Yeah. How did we then get to 250?
Okay, so what I'm going to do is, if you go onto our website, galengrowth.com, Health Tech 250, which is up in the left corner, I'm going to use that as my reference today instead of having PowerPoint slides, because as much as we all love PowerPoint, sometimes it's nice to have a change. And in this Health Tech 250 site, you'll find all the details as well as the lists that we're talking about. Right, looking at the methodology, Julien, which was your main question. Looking at Europe, looking at early stage ventures, right, that are still private, of course, and they were founded in Europe. The first metric we use is, okay, let's look at the top trending topics of 2022, right? What's going on in the world of digital health? What's being discussed, what's trending right now. So within Galen Growth, we can do that. We have a database of information about the world of digital health. We're experts in digital health, so we can pick out, okay, these are the top 10 trending topics. And using then that list of topics, then we filter our ventures for understanding, okay, who's actually working in those areas, who's using that technology that's trending, right? If we're talking about, hey, ChatGPT, which I know, Julian's one of your favorite topics, what ventures are utilizing such technology, right? This is the type of thing where was our first criteria is first cut, or the first prioritization, let's say, is looking at those trending topics and who's keeping current on the topics that are most interesting. Okay, after we have then that kind of higher metric, then the second metric we looked at was the Ventures Alpha score. Galen Growth has a number of proprietary analytics. Because we're experts in digital health, we can rank and rate the ventures in, I think we have 7 or 8 different rankings that we have for those particular ventures. The Alpha score is our kind of our biggest and best. That's looking at how mature the venture is. And keep in mind, we're keeping that maturity within those early stage ventures, right? So that's our metric number 2, is the venture maturity. As we go through, we'll talk about some of the other metrics. And when we look at the profiles, we can dig a little bit deeper into those.
Okay, so yeah, so the Alpha score is the ultimate composite score that we build, which essentially, to your point, is measuring the maturity of a venture. And of course, do you want to touch on how we're measuring that within an ecosystem? In other words, we're not, for example, comparing Europe to the US, because they're very different ecosystems in terms of their momentum.
Sure, we can do that. And you're very right. Since we're only focused on Europe here, the geographic location is one thing that we consider. We normalize the scores according to the geography, so that you can compare across the globe, right? You can compare the US ventures with the European ventures, although they have different funding, although they have some different characteristics. As well, since we're talking about all ventures here within Europe, we also normalize, for example, wellness ventures with oncology ventures, right? Of course, they're going to have different characteristics. So we make sure we compensate for that, do an ecosystem compensation, so that you can compare the ventures side by side. So absolutely, within the Alpha score, then we do a lot of ecosystem relevancy and ecosystem adjustment, so that you can compare those ventures side by side.
Okay, cool. And of course, we shouldn't forget, as it says on the screen, that the 250 ventures are actually available as a matrix to be downloaded by anyone with a HealthTech Alpha account, even a free account on HealthTech Alpha. So if you haven't done so already, do download the spreadsheet, because you can then play with it. But anyway, let's bring to life to that HealthTech 250. So let's switch to the list itself. And have a sense of, or let's start giving a high-level sense, I guess, of what got picked up in our 250 for Europe. Right. Again, feel free to ask your questions. We like questions, so please ask them.
All right. So once we jump into HealthTech Alpha, we can start looking at a little bit those other metrics as well, as we go through the different points. But you'll see the list of 250 ventures, which comprise our HealthTech 250. We wanted to represent the different regions, and you'll see those regions are part of the certainly part of the list and part of the criteria that we have. Now, if I jump to 100 ventures per page, so we can get a better view of what we have, then I'm going to go ahead and filter that the region for Europe quite easily. And I did count them earlier. We can scroll down to the bottom. You can see for yourself. We do have then 70 ventures that come up as being founded in Europe.
And just to recall, this is 70 within the 250.
Within the 250.
Okay,
yes.
Which is, of course, 250 as a fraction of the 14,000 that are visible on the platform. Okay, cool.
Correct. So the other ventures are outside of Europe, and we'll have webinars on those other regions later in this month. Okay, so what you see here is we're actually in HealthTech Alpha. As Julien mentioned, you can as well capture or have access to this list, and you start to see the depth of data that is captured within HealthTech Alpha itself. You see, in particular, all of these are private ventures, right? And they're all series in November of last year, they were all Series A and below. Peppy, for example, has since then raised their Series B at the beginning of this year. So since we're talking about high performing ventures, right, you should expect to see a lot going on actually since we did the analysis. But we can in fact jump into Peppy, for example, and see the venture signals that we talked about. The alpha score was 67.4. So that's that type of maturity you would very much expect to see. This venture has a product on the market, and they have, in fact, started to develop partnerships with that particular product. So that's what you should expect with the alpha score of 67.4. They may have multiple products on the market, actually. The alpha score is made up of 4 indices: the momentum index, market index, innovation, and money index. You can, once you're in Health Tech Alpha, tooltip over each of these and understand a little bit better what's in that particular score. But in addition, then we have a team signal, right? A team index, which is looking at the strength of the executive team, not only their education or type of education, but also looking at what kind of experience they have in other digital health ventures, right? So that's the team score. And then partnership score, which was the criteria number 3 on the list, actually, is looking at the number of partnerships and the significance of the partnership formed within that ecosystem. So Peppy here has a partnership score greater than 60, which is then getting to be a very significant, good partnership score. If we look in detail at the partnerships, they have announced 3 different partnerships, and the other 2 then were probably placed on a website without a particular announcement date. Right. 2 of them were announced last year. And we can look, Health Tech Alpha has a very easy tool to look across the industry verticals, seeing that 3 of those partnerships are within the insurance vertical, 1 with NHS, and then another with a financial partner, right? So it's a nice spread of different types of partnerships, different types of industry verticals. On the other hand, very strong partnerships, right? AXA, Aviva, very strong insurance companies, and the NHS, of course, taking up that type of partnership is very, very beneficial to getting their solution into the hands of patients, right, and of users. So that's what we're talking about with the 3rd criteria, the 3rd metrics, the number of partnerships and the significance of that partnership. We'll cover the next metric as well with Peppy, because as we talked about before, they actually had their Series B this January, I believe it was. Yeah, and looking at the funding, right? The number of rounds of investment was the 4th metric. Because Julien, maybe after I finish, you can talk about a little bit more about the importance of funding to young ventures, right? As we all know, especially last year became much more difficult. So the fact that these ventures are able to raise in a more difficult environment is fantastic. And we can look at within Health Tech Alpha, looking at Peppy, looking at its ecosystem, right? Looking within its peer group, the funding, the Series B of the peer group, Peppy's peer group, the median raise was 18.3 million. Right, for that peer group. So that's what this box and whisker is showing you. And they raised, in fact, 45 million. So they have outperformed their peer group actually in their last funding raise, right? Which is another indication that they're outperforming their peers, right? Again, the fact that they did that this past January is very significant, showing their strength. We could jump into their Series B. Again, let me show off a little bit about what you can do with Health Tech Alpha, looking at, again, their peer group and the investors that might have been there. So that's funding. Let's jump out of that and get back into kind of a more overview of what else is going on in the ecosystem without, getting too far into that funding hole, because as we know, there's a lot more to ventures than just venture funding.
Absolutely, and that's the good news about this type of analysis, which is we are looking at the achievements of the business as a whole rather than just the funding driver, and it's really trying to move this whole dialogue towards proof points. Looking at what the ventures actually achieved, which should drive a good funding outcome, as you just demonstrated with Peppy. Interesting question for you, though. Clinical evidence is one of the proof points that we are seeing and expecting to be increasingly important in any evaluation of any venture. It's not included in the analysis in late 22. So this analysis for the 2022. And then, going forwards, of course, we should see more of it. But what's your take on how much should a digital health venture at a Series A and pre-Series A level be able to demonstrate from a clinical evidence perspective?
That's a good question. We published last year, hopefully some of you have read our report on clinical evidence and clinical strength within digital health. And what we were able to show in that report is that the median age of a venture, when they have a significant amount of clinical strength, is actually 7 years, right? When the venture is 7 years old, then that's the median where you can expect half the ventures to have established some sort of established clinical strength. So since we're looking at here early stage ventures, it's not really expected that the majority of them have that significant clinical strength. If they do, it just kind of shows that they're excelling. And what we can do is we can go into our table of ventures and look at, first of all, clinical strength is based on 3 elements. Those are any clinical trials that they may have applied for or run, any regulatory filings that they have with regulatory bodies across the globe, and peer-reviewed publications, right? It's not based on patents here. It is based on publications. And we have then a signal called the evidence signal. And we can filter, or we can rank the ventures in terms of their evidence signal. If they don't have any of that evidence, what we just talked about, they don't have it. Their evidence signal is 0 or doesn't exist. And what we can see then is that there are, in fact, 1, 2, 3, 4, 5, 6, 7, 8, 9. There are a significant number of ventures that have an evidence signal greater than 40, which means they have at least 1 clinical trial, or they have at least 1 regulatory approval, or 4 peer-reviewed publications, right? So there's a significant amount of ventures here who do, in fact, can't tell you the number, but who do in fact have that clinical strength. That is very important to show that their product is in fact bring a benefit to patients or to the user.
Yeah, and it's good to see that data number is already that big, bearing in mind how young they are, and how little funding they have picked up generally, which we know clinical trials, for example, are an expensive process to go through. A couple of things worth noting here, of course, we did not apply a therapeutic area filter on, focus filter on there. Neither did we really in any way prioritize certain digital health categories. However, what we do know is that our Health Tech Alpha users will then apply those type of filters to it in order to identify, of course, the most promising ventures as fits their specific focus. And we've got plenty of use cases of where our Health Tech Alpha users are being able to identify those promising ventures, and therefore trying to align strategy and maturity of the venture. Okay, listen, in a few minutes we've got left, there are no questions yet. So in a few minutes we've got left, let's have a quick look at some specific, or let's say a specific venture in 2 or 3 specific ecosystems within Europe. I'm going to pick on Germany first, largely because with its DIGA framework, and more recently what it announced is its review of the DIGA framework, which was announced earlier this week. It has been the darling of governmental frameworks, reimbursement of digital health, etc., and the talk of the town for the past 12 months at least. So let's pick on a venture of your choice that ranked highly in our Health Tech 250 and was founded in Germany, and get a sense of what that looks like.
Sure, I'm going to jump down here to the agnostics venture, because they're in medical diagnostics and medical imaging, so you would expect them to have then some evidence, right? It's like the clinical trials, because not all ventures are going to have that clinical evidence, right? If you have a wellness app, or if there's some sort of online health community, right? There are definitely categories that aren't requiring as much evidence, or is more difficult to generate that evidence. Okay, so agnostics in Berlin, I believe, was one of the top German ventures that you saw, and just what you can see from the overview page of a very dynamic, very well performing venture. Not only do they have a alpha score of 6.7, which is very high, but their partnership signal is really way ahead of their peers. And that you can see looking at their partners. And we could go to the partner tab, right? Partnering with, for example, Charité is a very strong research hospital in Berlin. You know, other Technische Universität, so the universities and the hospitals. So they're being able to really get their solution into the hands of people who can get into patients, right? So fantastic partnerships is what you're looking at. Now we can click on, for example, products. They have then software is their main. Like I said, this is a AI-powered precision diagnostics for pathology, right? So they have software products that go into hospitals, for products that they can advertise, and as well they have 3 publications. These are peer-reviewed publications, giving evidence to their ability to follow scientific method and have a peer group that acknowledges the fact that they have a strong scientific methodology. Right. So, yeah, I mean, we could look at different parts of their profile, but I think if we want to jump to perhaps another venture that is, let's look at France. Mm-hmm. If you think because they were the top, they took the top place in Europe last year
in total funding. Yeah. Agreed. Yeah, absolutely. Let's do that.
All right, now, let's see, we will take the top one, Inceptor Medical. All right, again, a very high alpha score. And if you look at the partnerships that let's stick there real quick. What we can see from the very overview page and type of things that we catalog in Health Tech Alpha is their business model type, right? They're a B2B venture, right? Targeting those healthcare professionals, right? So they're not selling directly to the patients. That's because they're a medical imaging company, right? Incorporated in 2018. So I'm going on 5 years old at this point. And also here we're talking about a medical imaging companies, so they have a list of software. Don't have any type of mobile apps because that would be more of the B2B2C or B2B2P, direct B2C. But it gives us an idea of, let's see if they have, of why France took the top spot, because even in their Series A funding rounds in 2022, right, they were very strong. So that's France. And then I think we have time to go into the UK if we want. Let's do
the UK, because of course they're usually number one. And they certainly have a very large pool of ventures to pick from.
Mm-hmm. Trying to think if I can find one with a little bit with some regulatory filings here. But again, as an early stage venture, you're going to not have a large number of ventures that already have regulatory filings, other than perhaps some quality certificates.
Sure.
But we can try with Lindos Health, who are having a solution in the decentralized clinical trials category. Galen Growth has a very, very specific digital health taxonomy, which is looking at 18 different clusters across digital health, and each of those clusters is broken down into categories. Now, this is looking at the clinical trials cluster, in particular decentralized clinical trials. So again, it's a B2B type of venture, selling to not only to healthcare professionals, but then also to corporates. So most likely pharma companies or other biotech pharma looking to run clinical trials, right? And I must have pushed the wrong button because this one doesn't have any of those regulatory approvals, but you can see why they were picked for the Health Tech 250 in their really in their partnership strength, looking at their large spread of partners across the ecosystem. Somehow I clicked on that wrong one. Julien, how did you manage to do that? They were. I need the one about it. Could have reorganized the table, and that would have suited me well.
True.
Are there any other questions as we
No, we have no questions at the moment.
Okay.
So it seems to be everyone's comfortable with what they're watching and listening to.
Okay, great. Well, then if we go to cited, then we should be able to show a little bit of the depth that you can have in the profiles once you get to the more mature ventures that have, in fact, have some sort of regulatory approvals. This is looking at cancer. This is an oncology venture in diagnostics, excuse me. And what you see is in Health Tech Capital, we look at regulatory bodies across the globe, from the United States over to Singapore, to Korea. Within the UK, cited has indeed one regulatory filing, and they don't have any registered clinical trials, but they and they're looking at some software solutions which hasn't been in particular given any sort of app or any sort of direct acknowledgement within their webpage. But they are in the prescription analytics category, looking at partnerships within many different entities across the United Kingdom. Let me look. One thing that is interesting, and I don't expect it with this particular venture, but within Health Tech Alpha, you can see if that venture has operations or have products that are available outside of their founding country by looking at their location map. But cited is mainly focused on the United Kingdom at the time.
Right, the younger ones tend to have fewer operations abroad, preferring to focus on their existing team. Okay, thank you, Sarah, for that. So it gives you a flavor of some, as in a very small sample of the 250 that were included globally, and more important, the 70 from Western Europe that were selected using the criteria we used. Keen to obviously get your feedback on the criteria used in the methodology, because we're continuously looking to fine-tune it, improve it, augment it in order to continue developing a Health Tech 250 year on year that is truly looking at ventures that merit to be there through achievement rather than through social media activity. We would like to remind you that each of these profiles are visible in Health Tech Alpha. Just sufficiently, all you need is an account, and you can do that free of charge, and navigate and have a look at those profiles, or any other profile for that matter. Not necessarily limited to the 250. You can look at profiles that fit your area of interest. Probably a good time to wrap up, to say that, of course, Health Tech 250 is an annual analysis, and therefore towards the end of 2023, we will be obviously looking to publish the Health Tech 250 for 2023 with our new and improved methodology. But we welcome any inputs, any feedback from you as relates to that analysis, because we're continually looking to improve it, whilst at the same time remaining totally objective about who does get selected. Thank you for your time today, everyone. No questions, Sarah. So big thank you to you for some of the insights and I guess the spotlight you've put on the Health Tech 250 analysis for Europe. I mean, Europe is a very interesting and fascinating digital health ecosystem as a regional ecosystem, and of course there are some bright lights in each of the countries that sit within that Western Europe region. You know, we find it particularly interesting because the level of innovation is very high, the talent pool is significant, the valuations are more sensible, than they are in, say, in the US, which is proving attractive to investors as they look for that arbitrage. But you know, very interested to see how many of these brighter lights are starting to look at the US for their own scaling. And some recent analysis we've been doing, which will be our next report due out in a few weeks' time, looking specifically at US health systems. We were very interested to note the sheer number of European digital ventures that have forged relationships, partnerships with US health systems. So it's good to see that European innovation is getting picked up by US health systems going forwards. So thank you very much again, Sarah. Thank you to all of you for your time and your audience. If you haven't already, please go to Health Tech Alpha and download a copy of this matrix and look at it for yourself. And don't hesitate to come back to us with any feedback. Have a great rest of your day.